My name is Jessica Heibel, and I'm a congenital interventional cardiologist. Congenital heart disease is whenever you're born with something different about your heart. So it could be a hole or a valve that doesn't work right, or maybe one of the chambers for the heart didn't quite form right. So my particular specialty with interventional cardiology, I have the privilege of actually intervening. And so some of these things that patients come in to see us for, there's a hole or something that is wrong with the heart. And there are surgical options, but there's also less invasive options, including cardiac catheterization. And in some of those cases, I have the opportunity to close defects, and they're less invasive in that most of my patients either go home same day or the next day, and then are usually back to full activity within a couple of weeks of the procedure. So I do expect them, and I tell parents, I want your kids up and walking this afternoon if they're old enough to do so. And then for the older patients, the adults with heart disease that they have grown up with, I have them back at work or even exercising within a couple of weeks after the procedure. When I was about 5, I decided I wanted to be a doctor, and I'm kind of stubborn, so I just stuck to the theme. But in all reality, I really enjoy medicine. I love science, really love the complex physiology, love the patients, the families, and making these kids better. One of the draws for pediatric cardiology for me, compared to some of the other specialties, I get to follow these patients both in the hospital and out of the hospital. And sometimes I meet these patients and their families on some of the worst days of their lives. They come in very, very sick. And getting to follow them to hospital discharge and to see them in clinic, it gets stronger and better, and to meet these milestones that they haven't met before and to celebrate with these families is really what draws me to this specialty in particular.